My name is Victoria Cerna. I'm doing the head-to-toe assessment. Here's my Rhodes badge, and I'm going to start. This is my MAR. Hi, Mr. Bohr. My name's Victoria. I'm going to do a head-to-toe assessment. I'm a student nurse. Is that okay?
Yeah.
All right. I'm going to wash my hands. I'm going to identify the patient with two identifiers. Can I have your name and date of birth?
Jeffrey Allen Bohr, June 28, 1990.
Okay. I'm going to check that with my MAR. It's accurate. I would check the patient's wristband if he had one. And then I'm going to have you sit up for me. I'm going to help you to sit up. I'm going to ask you a couple of questions. Can I have, I would individualize my assessment to the patient's condition and the patient's needs. Can you tell me your name?
Jeffrey Allen Bohr.
Do you know where you're at?
Home.
Do you know what time it is?
7:10.
Okay, patient is alert and oriented times 4. Do you have any pain?
No.
Patient reports no pain. I'm going to assess your pupils. Okay, pupils, they're at a 6. I'm going to shine the light on you. Okay. 6 down to a 2. Pupils are equal and reacted to light. Okay, I'm going to check your upper extremities. I'm going to touch you. Is that okay?
Yeah.
Can you feel my hands?
Yeah.
Do you have any numbness or tingling?
No.
Okay. Skin is pink, dry, warm, and patient reports no numbness, no tingling. I'm going to assess the skin turgor. Hold that less than 3 seconds. I'm going to assess the capillary refill. I'm going to hold that for 5 seconds. Okay, so capillary refill and skin turgor are both less than 3 seconds. I'm good. Which is your dominant hand? Okay, I'm going to have you grasp my fingers and squeeze. Okay. Hand grasp is strong, equal. Can you wiggle your hands for me? Can you lift your arms? Okay. Any numbness, tingling, any hurt, any pain?
No.
Okay. Patient can move upper extremities, no interference. I'm going to have you close your eyes and lift your arms up. I'm going to check for arm drift. So I'm going to assess that for 30 seconds. Okay, 30 seconds. Patient shows no signs of arm drift. Okay, you can put those down. I'm going to assess your heart sounds. So I'm going to touch you again. Is that okay?
Yeah.
Okay. So I'm going to assess the heart sounds. I'm going to start with the aortic. It's going to be second intercostal on the midclavicular line. So there, and I would check with my stethoscope and my diaphragm and the bell. Pulmonic is going to be second intercostal on the left sternum. The aortic was the right sternum. Pulmonic is the left sternum. So I check with my diaphragm and my bell. And then for the tricuspid, it's going to be fourth intercostal. So 1, 2, 3, 4. That would be the tricuspid. Check with my diaphragm and my bell. And then for the mitral, it's going to be, I'm going to look for the midclavicular line. 1, 2, 3, 4 or 5. And it's right here. So I'm going to assess the pulse now for 1 minute. pulse is 72, strong. I'm going to check your breathing. You could just breathe for me. Chest is rising equally. Okay. I'm going to check your lung sounds. I'm going to check from the subclavicular notch to the 5th intercostal, and I will check bilaterally, so my diaphragm and my bell, listen to the lungs. Okay, then I'm going to check laterally. I'll have you lift your arm up from the axilla to the 8th rib, and I would check. Okay, you can put your arm down. And then I would do the other from the axilla to the 8th rib, and I would check. Okay, and then I'll have you lower your head for me. I'm going to do the posterior lungs, so I would look for C7, right there, C7, down to T10, so about there, T10. I'm not going to auscultate on any of the bony prominences here. And I'm going to listen bilaterally with my diaphragm and my bell in the upper, in the middle, in the lower. I'm going to have you lay down for me. I'm going to lift your shirt up, is that okay? I'm going to assess the abdomen. Abdomen is flat, pink. Can you feel my hands?
Yeah.
Okay. I'm going to auscultate in the 4 quadrants, check for bowel movements. I should hear bowel movements every 5 to 15 seconds. So I'm going to split into a 4, and I'm going to check with my diaphragm and my bell, each quadrant. Okay. Bowel movements are heard. I am going to palpate. Can you feel that?
Yeah.
Does it hurt? Any pain?
No.
Okay. Any pain? Okay. Patient reports no tenderness, no pain. I'm going to assess the lower extremities. I'm going to lift your pants up. Is that okay?
Yeah.
Can you feel my hands?
Yeah.
Do you feel any numbness, any tingling?
No.
Okay. Skin is cool, dry, pink. Patient reports no numbness, no tingling. Can you wiggle your toes for me and kind of like just move your feet a little? Okay. Patient has movement. No numbness, no tingling, no pain. I'm going to assess the pedal push, or the push and pull. So I'm going to have you lift your feet to your nose. Okay. And then I'm going to have you push down like you're pushing on a pedal. Okay. Strong, equal. I'm going to check the pulses now. I'm going to check the dorsalis pedis and the posterior tibialis. Posterior tibialis is here, so I would assess. And then the dorsal pedialis. Okay. I'm gonna lower these. I'm gonna have you roll over on your side for me. any bed sores, any skin that's not intact. On the bony prominences, I'm going to pay special attention to the coccyx. The coccyx and the pedal area. Okay, so skin is intact, skin is red, dry. Any pain?
No.
Patient complains of no pain, has no pain complaints. Roll back over to me. I'm going to lift your rails up, lower the bed, give you your call light, ask you if you need anything, explain the findings of everything that I did and my results. I'm going to wash my hands, and then I'm going to document it in the MAR. Skill complete.